So my understanding is health and policies is a strategy to address the underlying causes of health and wellbeing, and it's really about trying to influence the policy processes and decisions of other government agencies who have the levers and controls to actually influence health and wellbeing at the population level. I think health and policies is different to other healthy public policy approaches in that it's underpinned by a strong governance structure where oftentimes you have a central government agency providing the authorising environment and mandate for action. That's not always possible, but I think governance is still very important. So you may have other governance structures that work in other jurisdictions. So you might have interministerial committees or sub-cabinet groups that can work. One of the other things that I think is very important is that health and policies is more of a systematic approach to addressing public policy issues to achieve health and wellbeing outcomes, not a single issue approach. So where tobacco's had great success in working intersectorially to get really good outcomes, I don't see that as necessarily being a health and policies approach. It's been a single issue and the relationships are formed around a particular issue. Whereas a health and policies approach really depends on relationships being formed around a range of policy issues and being able to respond to them both in a proactive way rather than being in a responsive way. I think another part of health and policies that's very important is a strong partnership approach that's required to be able to build healthy, strong relationships across partners, across policy officers, and where health is actually a contributor to other people's agendas as well as a benefiter of working with others. One of the other things that I think is very important for health and policies is actually that we do bring an evidence base to the table. We help other agencies understand the interrelationships between their work and their agenda and the health and wellbeing of the population, and why focusing on health and wellbeing might be good for the economy or it might be good for education outcomes. So it's really about sharing our knowledge and skills and expertise in evidence and research with other parts of government who perhaps don't have quite that same level of expertise in that area.